Tyler Hamel, Kingwood chiropractor and TPI certified golf fitness medical. Today we're going to talk about another swing fault, and lots of the swing faults that I talk about have a relation to low back pain because I'm a chiropractor, so I'm going to see this stuff more often. So we talked about the S curve in the low back before, the S posture where you're standing like this and kind of your butt sticking out a little bit, which puts significant extra stress on that area. So the next one is called reverse spine angle. So what happens if you look at me facing forward, when I bring the club this way, there's a tendency of my whole body to shift like so. So reverse spine angle is the most common cause of low back pain, and you can see what happens when my right hip, say, isn't flexible enough to turn. So normally my right hip would be able to flex or rotate like this, and my spine kind of follows. But if my right hip is unable to do that, when I come up here, then my back tends to go this way and extend a little bit. So extension in the low back is what puts a lot of extra pressure in the lumbar spine. And you think if I'm extending like this and trying to rotate at the same time, it really puts a lot of stress in that area. So the main cause of that is just lack of right hip rotation. So you can think of rotation in the hip. Again, if it's not able to rotate as much, the low back has to try to compensate for that, and it just throws your golf swing out of the proper plane. So things to fix that, yes, there's lots of things we can do to release the glutes and the hip flexors, which will help this rotate better, which will take pressure off the low back and just allow you to swing properly, right? So when we talk about swing faults, it's usually some sort of the physical side of golf. Yes, you definitely go to the golf instructor and get them to show you how to swing properly, have the right mechanics, but if physically you're not able to do it, then you're going to have these different swing faults. And we know golfers oftentimes, they do have low back pain, right? And this can prevent them from playing, or they can't play as much, or they can't enjoy it as much because they're in pain every time they're swinging, and especially after they play a round of golf. So I'm Dr. Tyler Hamel, Kingwood chiropractor, Titleist Performance Institute certified. And if you're having problems with your low back while you're golfing, or pain after, or you're not able to golf as much, or maybe when you have low back pain, you're not going to be able to hit the ball as long or as far. If you notice things like that, pain during the round, can't hit your irons or your driver as far, and you might want to come and see somebody like me to work on the physical side of golf. Absolutely, yes, go to the golf instructor and get the proper mechanics down. But if you're still having issues, you might have to work on the physical side of golf. Everybody works on the mechanics and the practice of golf, swinging the club, but not that many people work on the physical side. So we know the different things just from past history with golfers coming in. We know the kind of things to give to golfers to help them improve their flexibility and stability and whatnot. So again, Dr. Tyler Hamel, any questions about golf, back pain, put it in the chat below. If you're a golfer, please, and you enjoyed this video, like it, share it. There's so many golfers around Kingwood right now that could probably benefit from seeing this video. So thanks for watching the video.